This is a special episode, and the topic tonight is myths versus facts about COVID-19 vaccine. This is going to be a great show, and it's sponsored by UNLV School of Public Health, the NAACP, the Latin Chamber of Commerce, Nevada Minority Health and Equity Coalition, United Natives, and KCEP, Power 88.1, where we are one, the People Station. So at this time, we're going to get right into it, and we're going to join our panelists on the webinar. And I would like to now bring on the moderator who will take it from here. And please welcome, ladies and gentlemen, Jose Melendrez.
Hello, everybody. Thank you for joining us tonight. We appreciate it. So my name is Jose Melendrez. I am with the UNLV School of Public Health and also currently chair the Nevada Minority Health and Equity Coalition. I have the privilege to introduce and work with our folks who are joining us tonight for our panel. So just quickly to share with you all, as you all know, we're at this next stage with this pandemic that's been hitting our community, has been hitting our country, hitting the world with the COVID-19. And now that we have this vaccine that's coming out, critical that we understand as a community that we all need to get vaccinated. We all need to understand how that process works. We need to make sure that the right message is getting out into our communities. And so tonight with our panelists, we've got medical professionals and community representatives who are going to talk from their perspectives and share their perspectives on it. So just quickly, the School of Public Health and the Nevada Minority Health and Equity Coalition are collaborating, working together with our community folks and other health professionals to make sure that we're doing our part, to make sure that the right message is getting out, that people are getting out and having access to the vaccine, especially people of color. As you all know, this past week, Governor Sisolak brought that to the forefront of the issue of the lack of equity in the vaccine process. And so the Nevada Minority Health and Equity Coalition, NAACP, the Latin Chamber, Roseman University, all of the folks that are going to be presenting tonight, United Natives, all of our panelists tonight, we're all going to be working collaboratively to make sure that we are getting the message out, that people have access and understand how this vaccine process is going to work. With that being said, I'm going to quickly introduce our panelists. As we were preparing for this session tonight, the outcry and feedback from the community was huge. And we already have a ton of questions that I'm going to be putting to our panelists. This is a public forum. We are going to be having a conversation. Once we go through the initial questions, then there will be opportunity for folks who are on the call tonight, on the Zoom call, Facebook, all that. There'll be opportunities for you all to submit questions, other questions if you have them, and we'll try to get through them. I want to thank KCEP for their partnership tonight, because I believe this part of this session goes until 6:30, until 7:30, and then it'll be continued until 8 o'clock with KCEP opening up the forum and continuing the conversation. So we will have opportunities. So again, thank you again, everybody, for joining us tonight. Thank you to our panelists. I will now go through quickly and introduce our panelists so that we can dive right into the questions tonight. So joining us from Roseman University, Dr. Christina Madison, who is founder and CEO of the Public Health Pharmacist Group. She has been featured in over 75 plus, and I think I've caught most of them, on-air interviews and conversations, and she is everywhere. So Christina, thank you for joining us tonight. We value your time and your expertise being with us tonight. Next on our panel tonight is Dr. Dominique Martinello, Chief Medical Officer for Southern Hills Hospital and Medical Center. He has been a key player in the study and communication of information concerning the COVID-19. Thank you, Dr. Martinello, for joining us tonight and being with us tonight. Next is, I can't say enough about this man, and in full disclosure, I am one of his board members on the Latin Chamber of Commerce, but Mr. Peter Guzman, who has been a phenomenal community member, community leader in our community for a long time. He is the president of the Latin Chamber of Commerce. And I know firsthand, because he's responsible to providing us information, I can't even begin to think about how many different boards and initiatives that he's involved with, especially in response to the COVID-19. So thank you, Peter, for being here tonight and joining us. Also next is Ms. Roxanne Mccoy, who I have the pleasure and honor of having known for quite a while. Her leadership in our community, her work in our community goes goes without mention, and is a strong advocate, not just for the African-American community, but I think she has a strong voice for all of our community. And thank you, Roxanne, for being here tonight and joining us. Next is Ms. Ayla Goody, who is with Immunize Nevada, has worked her personal professional career to combat health inequities and promote public health. I think we are lucky to have you. Thank you for joining us tonight and being here with us tonight. So, and last but not least, Dr. Crystal Lee, who I don't even begin to know where to start. Crystal she's just, you say the word Native American and she is everywhere. And when I read her bio and her resume, just all the different groups and organizations that she's involved with. Crystal is the founder of United Natives, who's here with us tonight, as well as just involved all over the place in Nevada, New Mexico, just everywhere. Crystal, thank you again for joining us and being here with us tonight. So with that being said, I'm going to dive right in to the questions, and then we'll, where we can, we're gonna open it up and let folks get involved. So our first question tonight is for Dr. Madison. Oh, well, wait, before we go there, I wanted to give each of our panelists an opportunity to quickly, if there's anything else you'd like to say about yourself or introducing yourself, but then also, why are you on this webinar tonight when it comes to messaging and the COVID-19? So first with that right there, I would like to start with Dr. Madison. Can you answer that for us, please?
Absolutely. So it is my utmost pleasure, first and foremost, to be on the panel discussion today. As a woman of color and as someone who's dedicated to public health and equity in our community as a Nevada native, it's an honor to be a part of this distinguished panel. And as far as why I'm involved in this vaccine effort and just really wanting to get facts out, is because of the fact that I am a woman of color and because I am a public health professional. There was no possible way that I wouldn't have been involved in this vaccine rollout. This is basically my Super Bowl. Being the fact that I was embedded in our county health department for about a decade, I was involved in H1N1 rollout. So this is just that on steroids. So there was no possible way that I wasn't going to be involved. This is something that I teach my student pharmacists about, my student nurses about, and is something that I really am advocating for as far as our interprofessional collaboration, and then just really pushing for pharmacy professionals to be more recognized as the heroes that they've been during this pandemic.
Thank you. Dr. Martinello?
Oh, thank you. I want to thank everybody really quick for having me out here. To give a little background on why this was so important for me to be a part of, my training and background is in emergency medicine. I was a frontline emergency physician really at the beginning of the pandemic. And this is something that we read about, we trained for, we prepared for, and then we all thought that during our life this would never happen. And once the pandemic hit, it became very evident that a lot of our training was going to be put to the max. And now that we have something as wonderful as a vaccine, it behooves all of us throughout medicine, throughout our communities, to ensure that every person within our communities, regardless of who they are, of what color their skin is, what religion they believe in, where their family is from, it doesn't matter. What matters is that they have the most accurate, up-to-date information on this vaccine so that they can make a choice and really determine what is right for them. And we hope that that choice, of course, will be that they have that information and choose to be vaccinated and help end this pandemic, so that all of my colleagues out there can really look back at this instead of looking into it every day, and save all of those lives that we really do want to come out on the other side with.
Thank you. Peter?
I had a little bit of problem hearing your question. I apologize.
So my question was, why are you on here tonight, and what does it mean to, with the whole vaccine messaging and everything that's going on? And if there was anything else you wanted to share with us in regards to your introduction.
Yeah, and I apologize. I just got new Wi-Fi in the office. But listen, I'm here because, number one, I want to thank Roxanne Mccoy, who's been an incredible friend, collaborator for many years, and just grateful to be able to be here with her. Listen, our folks are not getting good information. They're getting bad information at the speed of light because of social media. And so because of that, a lot of Latinos are a little scared. And so I'm here because I want them to know that there's nothing to be scared of. The only thing to be scared of is not getting vaccinated. Because if you don't get vaccinated, you're going to get sick and you could possibly die. And on top of that, we're not going to open up our economy. So that's my passion. I want people to know that you must get vaccinated as quickly as you possibly can, and there's nothing to fear.
Thank you, Peter. Roxanne?
Hi, thank you everyone, and thank you all the panelists for being a part of this tonight. My reason for wanting to be a part of this is because, you know, this vaccine is really, really important, like Peter and all the other panelists before me said, is that I'm a woman of color, obviously, as well, and this has disproportionately affected our community tremendously. And if we want to get back to any sense of normalcy, we need to educate ourselves on how this vaccine can assist us in doing this. And I understand that there's a lot of fear surrounding this vaccine in our community. And I want to try to dispel as many myths as we can with the professionals that's on the front line that can give us facts versus the myths, so that we can make an informed decision about what we're going to choose to do moving forward in order to eradicate this pandemic within our community. So that's why I'm here.
Thank you, Roxanne. Aaliyah?
Everyone, super happy to be here with you all tonight. I wanted to be here just because I understand the importance of reaching all of our Nevada communities and disseminating correct and easy to understand information. I also just really understanding the need to always meet our communities where they are with their information and helping them to really just understand on their level why this vaccine is like super important. I have always been an advocate for public health and for positive public health change, and just really wanted to be here tonight to help dispel some of those myths and misinformation and things out there for all of our Nevada communities.
Thank you. And Dr. Lee?
Hello, thank you for having me on here. I am originally from the Navajo Nation. I was born and raised on the Navajo Nation in Arizona, and have been working with tribes throughout our nation in multiple capacities. Often we are not represented in a lot of spaces to discuss a lot of our adverse health issues. And my tribe specifically had one of the highest rates of cases per population capita in the world, not only here in the United States, but in the world. And so I think it's really important for tribes, not just in the state of Nevada, but all tribes, to truly consider the vaccination, because not only are we losing a lot of our tribal members, but we're losing a lot of elders. And within the context of losing our elders, there are a lot of our knowledge keepers, our wisdom keepers, and we're losing just more than a person. We're losing a lot of cultural loss, language lost. And so I'm really here on behalf of our communities to address the importance of it and saving not only lives, but saving our culture and our languages as well. So thank you.
Thank you, Crystal. All right, so then let's dive in. Like I said, we had a ton of questions submitted when people started seeing this was going to be happening tonight. So our first one is going to go to Dr. Madison. Many of our community members are concerned about how fast the vaccine was developed. Can you explain how they developed the vaccine so quickly?
Absolutely. I think this is one of the #1 questions that I get asked, is this perception that somehow the vaccine development was rushed. Also, there is that perception because of the fact that we named our vaccine development Project Warp Speed. So you can't blame people for thinking that this was rushed, right? But I'm here to tell you that that really isn't the case. And so one thing I want to just start out with is the fact that the coronavirus, in particular, what causes COVID-19 is the virus called SARS-CoV-2. And the reason why it's called SARS-CoV-2 is because it's about 80% genetically similar to the SARS virus. And so if we look back at when SARS actually was identified in Asia, that was in 2002. And so that genetic sequence of that virus was done then. And that is really what started the ball rolling with research on how to potentially provide a vaccine to that particular virus. We also had MERS, which is Middle Eastern respiratory virus that came to being in 2012. Luckily, that did not reach the same levels as SARS infection and was really limited to one geographical area. But because of that, there was a lot of research that was being put towards if those two infections, because they're both part of the coronavirus family, if those two infections came back. And so we have really been studying the possibility of having a vaccine for those two infections for the past 17 years. And we did actually test a vaccine in 2018, specifically against MERS. So when you think about all of that research, we were really very lucky that we had that as a starting point in 2020 when we sequenced the genetics of SARS-CoV-2 in January of 2020. So that happened first, and then we really went off of the backs on that existing research, because not only did we have a singular focus, because this was something that was impacting the entire world, but we had a massive amount of funding that was put towards this effort. So singularly, we had everyone in the world really working on this. And at that time in April, we had 4 vaccine candidates that were being tested. The other thing too that was unique about this particular vaccine versus other vaccines in the past is that we did phase 1 and phase 2 studies simultaneously. And then we had phase 3 that started and that was being done at the same time as vaccine supply. So the fact that we had massive amount of fundings, the benefits of the existing research on both MERS and SARS virus really helped with the development of getting this from sequencing to vaccine EUA, which was in December of this past year. And then from that EUA that was issued in December of 2020, we had the first vaccine being administered in New York in December 14th. So hopefully that helped a little bit to dispel some of those rumors. But again, massive amounts of funding, singular effort, the entire world was working on this, as well as having the benefit of existing research for a very similar coronavirus.
Thank you. Next question, Dr. Martinello, how does the vaccine work, and does it give you COVID? Does it change your DNA?
Okay, so why don't we start first with how other vaccines work, and then it'll make a little bit more sense. So a normal vaccine that we receive, say, every year with the influenza vaccine, we're given an injection of what is either a small protein that looks like part of the virus, or a small inactive non-infectious piece of virus. And what that does is that allows our body to take a look at what parts of the virus look like. We can develop antibodies and some cellular immunity, and then we can be ready to fight it off. This vaccine is a little bit different, but essentially gets you to the same place. So in this vaccine, you're injected with what they call messenger RNA, or what we shorthand call mRNA. What mRNA is, it's something that our body naturally produces 24 hours a day, 7 days a week for the entirety of our life in all of our cells. And it is a little message that tells us how to make a very specific protein. So every protein that your body makes, whether it's the keratin for your skin or a digestive enzyme, all these are made beginning with mRNA. So we inject into the body a little tiny piece of this mRNA. It goes into our cell, and then it uses our cell to produce a small protein, in this case, what they call the spike protein from the outer surface of the coronavirus. It is non-infectious. You cannot get COVID from it, but it allows your body to develop an immune response to this very specific spike protein that all of the coronaviruses carry. And that's what allows the coronavirus to actually enter into the cell. So now we have an antibody that's produced against this little piece of protein on the outer surface. And it's common to all of the coronaviruses. So the idea being this mRNA makes a couple of copies of this protein, and then the mRNA is recycled back into the cell just like its own mRNA would be. Now the body is primed so that if you come into contact with the coronavirus, your body knows what it looks like. It's already generated some antibodies against it, and it can ramp up its response very quickly to fight it off. So that instead of you becoming infected and getting sick, your immune system simply takes care of it as if you had been infected with it in the past. And this would also happen if you had COVID in the past. You would have some antibodies. This just allows it to be very specific and not require you to contract a potentially deadly disease first, which is why we vaccinated in the first place. As far as does it give you COVID, like we said, no, there is nothing infectious about this. It's only a tiny little protein on the outer surface of it. And does it change your DNA? No, absolutely not. So the inside of the cell, you have the outer cell membrane on the outside of the cell, and then you have the cell nucleus, which is where all the DNA is stored away for the cell. The mRNA cannot enter into that cell nucleus, and science can occasionally develop things that can get into the nucleus of a cell. It's tremendously difficult, and it wouldn't do what we need it to do. So the mRNA, very easily uptaken by the cell, makes these proteins, tells your immune system what to look for, and then that mRNA is recycled back into the individual amino acids that it's made. It's very elegant technology. It's surprisingly simple. And it's also another one of those reasons that this vaccine is very quick to produce in large quantities, because making messenger RNA is much simpler than trying to manufacture viral proteins natively. So again, this is not new technology. Many of these companies have been working on mRNA vaccines for decades. It's just this is the first one we're seeing really come out to market. So we understand it's scary and it's new, but it's just taking something your body naturally does and just giving it some extra instructions.
Thank you, Dr. Martinello.
My pleasure.
So our next question is going to be for Dr. Lee, Roxanne, and Peter. Why are some of the community skeptical or hesitant to or about the vaccine? Dr. Lee, can we start with you? You're muted, Dr. Lee.
Okay, sorry about that. Yes, absolutely. As we all know, the historical context of historical trauma, and specifically some of the relationships that we've had with the federal government and our sovereign tribal nations in terms of treaties being broken, mistrust with the federal government and implementing quality healthcare services that were treaty abiding. Actually, as part of our treaties, we agreed to, in exchange for land, to be federally funded for healthcare, housing, and education. And that all three components have not been fully funded, nor do we have the quality of implementation of healthcare services as well. So there's been a long continuum of decades of mistrust as being Native American, and especially within the Indian Health Service care system. And so our tribal members have been very concerned about the dissemination of the vaccine due to the continuance of the mistrust that we currently have experienced. Thank you.
Thank you, Dr. Lee. Roxanne?
I will echo some similar sentiments to Dr. Lee. The African American community has a huge distrust of our healthcare system and our federal government because of a lot of experiments that have negatively impacted African Americans. And one notable one that went on for many, many years is the Tuskegee experiment, where they experimented with African American males and syphilis to see how their bodies would respond to that. And they were told that it was something else when they were actually being injected with syphilis. So that, amongst many other tests, have been performed unwillingly on African Americans through our federal government. And so it has just left a huge mistrust in terms of being adequately cared for by our government system when it comes down to making sure that we're getting the best treatment that is available for us out there. So it's been taking place for generations going back to slavery, when African Americans have been used as test objects negatively by the federal government. And so right now, today, we just don't trust that they have our best interest at heart. And so.
Thank you. Peter?
Yeah, so, you know, for us, for our community, the Hispanic community, it's a little bit of mistrust, but it's a whole lot of misinformation. It's, you know, it's one neighbor telling one person something they read on the internet, that this vaccine has a chip in it and it's going to lead to ICE immigration coming and picking people up. That is real in our community. A lot of people don't get that. It is real in our community, and it is every day. Why? Because we've been deported and we've been caged. And so immigration issues is real with us. And so when abuelita, grandma, it even crosses her mind that maybe somebody in the household is maybe here undocumented, she's not going to take that chance. She's not going to take that chance. And so what happens is she shares that with another neighbor, and with today's speed, it's all of a sudden a whole block is not getting vaccinated when they can. And it all leads to from chisme, which is gossip in Spanish, and misinformation. I don't think it's a trust, because all the Latino Hispanics I talk to understand that our healthcare, you know, our medical industry, we have smart folks in the United States doing it right. So the vaccine's not meant to hurt anybody. Pfizer wouldn't do that. And yes, the speed of which it came maybe made a little bit nervous. Some people are nervous, but I'm just telling you, in our community, unfortunately, it's the misinformation and the speed in which it gets into each house.
Thank you, Peter. Our next question is going back to Dr. Madison. How do we know that the vaccines are safe and effective for minority communities?
So excellent question. So one thing that I would highly recommend for our listeners and our viewers to do is to actually go and look at the study data for both the Pfizer and Moderna products. One of the things that I really appreciated about the Moderna product in particular, which by the way, the lead scientist on is an African-American woman, FYI, and it was developed through our National Institutes of Health, is that they actually halted their study because they did not have as much diversity as they had originally projected. So they actually delayed the time frame that they were thinking that they would go for emergency use authorization, because they wanted to recruit more communities of color and more diversity in their study population. So that's one thing I would absolutely encourage everyone to do, because the data really does speak for itself. I trust the scientists, I trust the FDA. They thoroughly reviewed both of the products prior to providing them with the emergency use authorization in December of last year. The other thing too that was very interesting when you look at the data is who was more likely to experience side effects versus those who were less likely to experience side effects. The two major things that they saw that were a consideration of whether or not you were to experience side effects was your age and whether or not you had existing antibodies against COVID-19, meaning you may or may not have known that you were COVID-19 positive. And so those who had recent antibodies within the last 90 days had a more likelihood to experience side effects associated with the vaccine, as well as if you were younger, because that more robust immune response was seen in people with competent immune systems. So the other thing too that I will say is personal experience. So I have now received both doses of the Moderna vaccine. So I will tell you, I survived. I did absolutely experience more side effects with the second dose, but it was expected because, again, that was something that was detailed in the information provided by Moderna in their study materials and their trial data. So I think that we need to trust the science. And yes, I agree that we don't have long-term data right now, but this is an unprecedented time for this messenger RNA product. The CDC created a brand new real-time surveillance program called vSafe. This is the first time we've ever done this before. Prior to that, the only way that we would find out about adverse effects was through something called VAERS, which is the Vaccine Adverse Event Reporting System. And that was a delayed effect. So really, you only got data if someone chose to enter it. But this is real time, and people are being asked to input information the first week of their vaccination and then weekly thereafter. And that surveillance data will be done for up to 2 years following people getting vaccinated. So again, this is the first time we've ever done this, but I really do think that we are doing our best to make sure that if there is issues surrounding either an individual lot, which we did see that there was some suspension of a particular lot done in California, but then it was investigated and it was found that it wasn't attributed to the vaccine. So I think when we do see that there may be a problem, we stop, we investigate, and then we use the science to move forward.
Dr. Madison, is there a specific place or link where folks can go and find that research that you just spoke about?
Yeah, absolutely. So Centers for Disease Control and Prevention or the FDA. And if you actually just type in Moderna and type in EUA, which stands for Emergency Use Authorization, it will pop up with the fact sheet with all the with most of the study data. I think there's an individual link that you can access with the full addition as well as the supplement that goes with the study data that was published. So you can do that for both Pfizer as well as Moderna. So Google is your friend in that regard. There's lots of ways that you can search, and typically will come up with what I consider a reputable source. So you can always tell if it's got GOV at the end or EDU, right? So either education or government. So those are the ones that you would trust. And again, the Centers for Disease Control and Prevention, HHS, or NIH.
Thank you. This next one is going to be for Aaliyah, and I know this is going to be a tough one, Aaliyah, so I hope you're ready. Vaccines are currently scarce in the state. Can you talk a little bit about what is the current availability and how do we ensure that those who need it most are getting the vaccine?
So I will do the best I can to explain this for everyone. So currently the state of Nevada receives limited doses of the COVID-19 vaccine. And it's not just our state, this is nationwide. And that is really just based on the availability of vaccine in our nation. And so doses each week, the doses are allocated to our state and then down to the county level and into our sites like on a weekly basis, depending on the allocation of what the federal government has given us that week. So really the availability really just depends on how much vaccine is available, and currently it is on the low side. So the availability of the vaccine is low due to the low allocation. If you need additional information about where you can get vaccinated in your county, I did want to put out that you can visit MV COVID Fighter. So that page contains a variety of resources, even on the county level, about where you can get vaccinated, who your county is currently vaccinating. And so please utilize that website as you can. It is updated regularly to reflect current information for all of you to have. And then to the question about ensuring those who need it most are getting it. To really ensure that those who need it the most are getting the vaccine, especially because the allocation is currently so low. Vaccination efforts really continue to focus on those who are critical to the COVID-19 pandemic response, those who are providing direct care, maintaining societal function, and then as well as those who are at high risk for developing severe illness from COVID-19. And then the other piece is really communication. And so that's really making sure that all of our communities in Nevada have the information about when it's time for you to get vaccinated, how you can get vaccinated, where you can get vaccinated. And it's really really meeting everyone where they are with information. And so we have have really been working with our community partners to help disseminate information for everyone so that the information is out there. And then also really working to really understand where our different communities are with information. So where all of our diverse communities are, what the myths are out there, what misinformation is being circulated around, and really addressing it as we can. And again, really in partnership with our community partners, with our state leaders, in order to get this information disseminated for you all. So it's really to ensure everyone's getting it. It's really I think the communication piece is big, because if there are myths and you know all the myths and misinformation there, then that definitely dissuades people from wanting to get the vaccine, and so people aren't getting vaccinated that way. And then also just making sure that information is easily accessible and readily available, so folks know where they can get vaccinated, when they can get vaccinated, and how they can get vaccinated.
Thank you, Elia. And so for folks who are submitting questions, like I said, we're going through the first set of questions that we received, and then we'll open it up for some of the other questions that are coming in. So be patient and hang in there with us. So for Dr. Madison, why do I have to wear a mask if I get the vaccine?
So this is another excellent question. And something I do want to highlight is that the Centers for Disease Control and Prevention today actually endorsed double masking today for the first time. So that is also something that I want people to know is a newer recommendation to try to help prevent the spread of COVID-19. So the reason why you still need to wear a mask after you're vaccinated is twofold. One is to protect yourself, because we do still have variants that are out that are multiplying quickly. We now know about a newer variant that is from California, in addition to the UK variant, the South African variant, and the Brazilian variant. So again, this virus wants to live, and that's what viruses do. They mutate so they can survive. So until we can get the population vaccinated and get to herd immunity, we still need to protect ourselves and those around us by trying not to either contract one of these new variants, right? Because we know that there is still a possibility that the vaccines may not prevent us from becoming infected with those variants. It will, however, prevent us from having mild to moderate illness. And then in most cases, almost 100% will protect us from getting severely ill, hospitalized, or death. And so those are the two big reasons, right? So we want to protect ourselves because we want to protect ourselves from these new variants, but then we also want to protect those around us because we still don't have specific data for these messenger RNA products that say that we will not asymptomatically transmit the virus even if we're vaccinated. We have recently gotten data out from AstraZeneca saying that that particular vaccine does prevent transmission in the individual that's been vaccinated, but we have yet to see that data for our messenger RNA products, and the AstraZeneca product has not received EUA status here in the United States. So 2 reasons to continue to wear a mask. And now, as of today, CDC is recommending double masking, which means surgical mask and then cloth face covering that's tightly woven and at least 2 layers on top of that. We know that the fit is extremely important as well. So making sure that not only are you wearing both of those masks, but you are tightening the ear loops and you are making sure that you have a snug seal around your nose and mouth in order to prevent those respiratory droplets from getting out.
Thank you, Dr. Madison. And just keeping with this conversation about the mask wearing, because it's such a simple thing, yet it's been such a political issue to our community leaders that are on tonight, Roxanne, Peter, Dr. Lee, Aaliyah. Can you share what are you hearing or what have you witnessed when it comes to the thing of mask wearing? Roxanne, can you start us off? I know I'm
Yeah, sure. Oh, it's okay. In the beginning, I think there was a lot of resistance to wearing the mask because there are a lot of myths going around the African American community that they didn't believe that Black people could get COVID in the beginning. And so we weren't wearing masks at all. But as time went on and this pandemic started ravaging through our communities, our families, we began to see the seriousness of this disease taking place. And so we are wearing masks. I see more people wearing masks that are people of color than not. I am shuddering to think 2 masks when I can barely breathe in one right now. But I think that everybody will need to do what's necessary if we want to get back to life as we know it. But in terms of my community, I see the majority of the people following the rules and wearing their masks, which I am happy to see. But in the beginning, it was a little slow in making that progress. So,
Dr. Lee?
Yes, so I think one of the biggest challenges in our rural reservation-based tribal communities is the lack of resources to allocate such proper equipment. I have seen relatives who have the limited resources. I mean, if you take a reservation land base, there's probably one gas station around, maybe one grocery store in an hour and a half radius. And so a lot of our members are having to drive really far to get these resources. And due to that, there's a lot of improper mask wearing, multiple uses with one mask. Now, if you talk about our communities, what about if they wash it continuously? Well, a lot of our tribal communities, especially the Navajo Nation, 1/3 of our population does not have access to running water. So therefore, we cannot wash masks appropriately to reuse them. So I am, it's basically about the limited resources that we have from our tribal communities. It's not so much that we're resistant, we just don't have the ability to access them as other populations in other areas.
Thank you. Aaliyah?
I'll kind of echo what Roxanne was saying. I think initially it was from my perspective really hard for communities to understand the necessity of mask wearing, just because the pandemic had just begun. The effects weren't very well seen at the time, but I think as time moved forward and really seeing the effects of COVID-19 really play out, mask wearing became more widely accepted. I think a lot of some of the things I also initially saw was just the question of where do I get a mask? Like, how do I even get a mask? Like, where do I get that? And I think I often see masks just about everywhere I go now. And so they're a little more easily accessible. At least I can speak to Clark County just because that's where I am. I think here and getting a mask and wearing a mask. And I think really also just continuing to emphasize that after vaccination, again, echoing Dr. Madison's point, like it's still really important to continue to wear the mask even after you've been vaccinated, just to make sure that the community continues to stay safe. And we kind of beat this pandemic here. So that's kind of what I've witnessed and observed.
Thank you. And Peter, I know the Land Chamber was also involved with at the beginning with getting masks out to folks. And I know I picked up, I don't know how many, couple of hundred that I was taking out to some of the centers where our construction workers were gathering and handing them out. What was your thoughts on that?
First of all, it was not a couple hundred that you grabbed, because you got quite a few boxes, and we commend you for that. The reality is that we at the Latin Chamber, we got a call from our chairwoman from the county commission, Marilyn Kirkpatrick, who's been extremely active. And she was disappointed that, a large part of her district, which is very Hispanic, well, we're not wearing masks. Well, they didn't have them. So in a matter of 3 weeks, and you participated, Jose, we gave out over 27,000 reusable masks. We went into the neighborhoods and passed them out. We went to the grocery stores. We know where they congregate on the weekend. So, it wasn't as hard as it sounds, but very proud of that work, that we were able to get those masks out, because it is so important, and I'm looking at the chat box, and Dr. Christina Madison, who's doing an amazing job tonight, put out about masks, the Biden administration. I remember my friend Sig Rogich calling me about 6 months ago, maybe even 8 months ago, with a plan that he asked my help with. And he sent a letter, an amazing letter, to the Trump administration with the idea of giving out masks to every American. And they completely laughed it off and rejected it. And now I thought it was an amazing idea, and I'm glad it's going to happen now, because to me, this isn't about R or D. This is about life. This is about saving lives and doing what's right and getting this economy back open. And so the masks became very important. And I echo what my colleague Roxanne says. Everywhere I go now, I see people wearing masks. So I think that has resonated.
Thank you. Our next question is for Dr. Martinello. Does the vaccine work against, we've heard all this coming out now about the different strains that are coming out. Does the current vaccine work against those different strains of the COVID-19?
Sure. So my colleague, Dr. Madison, touched a little bit on this. It covers a vast majority of the most prevalent strains right now. Now, there are several additional strains. The UK variant, as it's often called, was tested against the Moderna vaccine, and there was significant efficacy against it. There is, however, a South African strain, a Brazil strain, and now a California strain, all of which have some resistance to it. Now, that's not to say that the vaccine is completely ineffective. It just has slightly less efficacy against these particular strains. And that's because the coronavirus does mutate on a fairly frequent basis. Now, a lot of these mutations that happen make it less infectious, less dangerous. But once in a while, if you move this virus around enough, you will get one strain that is more infectious, and that one generally becomes more prevalent. So the vaccine will cover a vast majority of the existing ones. And why that's important is because every person that's infected will have some mutations taking place within the virus that's in their body. So the less people that we can get infected, the less opportunity that this virus has to mutate. And this is where also those, what we call non-pharmaceutical interventions, really help. So masking, hand washing, social distancing. Every person that we can prevent or even delay infection in is less likely to have a mutant variant that could evade our immune system in this vaccine. So by and large, it's extraordinarily important, even if it's not 100% or like these great vaccines that are 95% effective, because that's really an incredible number for a vaccine. Even if it goes down to 65%, so you're vaccinated, you get one of these odd strains, if you can slow the spread of it down, then you slow the spread of the mutations and you will eventually get control of this disease. But it's a combination of vaccinating against the most common types and the non-pharmaceutical interventions, hand washing, mask wearing, social distancing, and we will be able to get control of this. And the benefit in addition to that with these new mRNA vaccines is that as we sequence these mutations, if one of them does become more predominant, all of these mRNA companies that are developing vaccine right now, they can modify the vaccine on the fly and begin sending out booster doses if necessary to cover these newer strains of it, so that we can respond to the vaccine we can respond to the virus with the vaccine almost as quickly as it can mutate. So we can truly stay ahead of this, but it really does depend on us getting a large portion of the population both vaccinated and using the masking, hand washing, social distancing.
And thank you, Dr. Martin. Those are so critical points. And I'm loving what Dr. Madison is putting in the chat box, because she's putting a lot of religion out there, as I like to say, in regards to if it doesn't have a host, it can't reproduce. So all of these things are critical, folks. The next question is for our community folks, Aaliyah, Roxanne, Peter, and Dr. Lee. Can you share why you think it is important for your community members to take the vaccine? Why is that important? So we'll start with Aaliyah. Let's start with you first.
Yeah, so the vaccine is really important in our efforts to get back to life. The vaccine, it helps prevent you from getting seriously ill. It can help protect those around you from getting seriously ill. So your mom, your dad, your family, your friends, your team members, co-workers, really just overall really crucial in helping to protect the community. Especially those who might have increased risk of having severe complications from COVID-19 overall and in general. It really is one of the best tools we have now to stop the pandemic, to end the pandemic, and to get back to life. I always say I don't know about you all, but I miss popping in on my mom and my grandparents here and there. But now really just recognizing that it is on me to make sure that they are safe. They both and all suffer from some of those underlying health conditions, and I would hate to ever do anything that might critically harm them. And so this vaccine is really, really an important tool and just getting back to life, and really reuniting with our close family members and community. And it's just always just really emphasizing that it's safe, like it is safe to use, and it is an important tool, especially right now.
Thank you. And Peter, you're next. I know you mentioned why the vaccine was critical earlier. Can you touch on that a little bit more, please?
Well, yeah, and even further for the Latino community, we tend to have multi-generations living in a household. It's very, very common for us to have our parents, and the grandparents have grandchildren, so multi-generations. And so how are you going to keep a household safe? You're going to keep that house safe by wearing masks and by getting vaccinated as soon as you possibly can. That's the way we have to do it, and we have to keep pushing that so that we can get life back to normal. And there's so much going on that we don't even know about yet. The mental health issues, the depression, alcoholism, all the things that a lot of those things affect our communities of color already. So this just exaggerates it. I mean, it just takes it to a whole nother level that, we're going to feel the pain of this even when we way after COVID. I mean, there's going to be issues, and it's going to take community leaders to stay involved and stay engaged to save our country.
Thank you, Peter. Roxanne?
I echo the sentiments of Aaliyah and Peter as well. I think it's important for us to take the vaccine just so that we can save lives. We've seen lives taken at an alarming rate in this past year and a half, and it hits very, very close to home. We're watching family members dying alone in hospitals, and people afraid to go and get help. And those that are being affected with COVID are just really suffering and having long lasting effects after they've gotten over COVID. And so if we want to see any sense of normalcy, at least a little bit as we knew it pre-COVID, the vaccine is going to be the way to do it. We cannot continue to go on as we have been. Before the vaccine was rolled out, we saw those numbers really rising high, people contracting the virus, people expiring because of the virus. And I personally would like to see that trajectory change in a downward motion, and we start seeing less people hospitalized so that our frontline workers can get back to their families and their lives. And so we as communities can get back to living our lives and open our economy back up and keep our families and our loved ones safe.
Thank you. Dr. Lee?
Well, from a cultural context, we're all interconnected in multiple ways, whether it's through the ecosystem, through our relational clanship systems, intertribally, and within our tribes. And so it's about really ensuring that our relatives are taking care of themselves, and it's not, it's helping our whole community as a whole, as we all do this together, because we're all, we have a lot of relations in our community, and in Navajo it's called K'e, which is the single most important thing in our community is our relationship to ourselves, our relationship to our family, our relationship to our community, our relationship to the ecosystems, the plants, the animals, and even the universe. So we have this huge responsibility of ensuring that our relationships are kept safe. And in addition to that, again, that I have known over 60 people personally who have passed from COVID. And my grandfather's, one of them just passed away on Wednesday last week. Now, when I also talk about how much we're losing through our elders, our language and our culture is being lost for every elder that we lose, which is very significant in our communities. And in addition to that, we have a lot of ceremonies that require some sort of gathering. And because of COVID, we're unable to upkeep within our ceremonial systems that help to retain and learn the language and the culture as well. And my organization runs an entire quarantine site in Phoenix, Arizona. So since COVID in March of 2020, we have serviced over 1,000 Native Americans in the state of Arizona and neighboring states. To number one, we do quarantine services, but in addition to that, we address mental behavioral health and in our communities and communities of color. Substance use increase, domestic violence increase, housing security increase, mental health decrease. So we're seeing a lot of the lashback that COVID has did to our community. And right now I'm actually at our site, and it's to get that firsthand of the experiences of helping families to know that the resources out there are so needed. And just getting the vaccination is extremely important for so many reasons. So thank you.
And Crystal, you touched on something that's important. And I just want to say that I know several of our panelists tonight and many of us this is very personal. We all have loved ones that we've lost and friends that we've lost and, mentors. And, this is hitting us across the board. So I hear you loud and clear. And this is very personal for a lot of the folks on the panel tonight. So I want to thank you for doing this. We have another, again, I want to thank KCEP for being in collaboration with us tonight to present this. And so as part of a big community voice here in Southern Nevada, Professor Knight, Lady AK, Mr. Lou Collins, how could each of you share why this is important to you tonight and why you decided to engage with us tonight?
Yes, thank you, Jose. I'm gonna let Lady AK go first if she's back on.
I am here. I was yelling at the baby. I'm here.
Okay, go ahead.
Oh, no, I don't have anything to say. I'm just letting you all know that I'm here.
Okay. Lou, did you have anything to add to this of why this was important for you to be a part of it or on?
You know what? It was, first of all, hello to everyone. Amazing insight and dialogue, because again, as you go about the community, primarily African-American community, there's several questions being asked. And of course, President Roxanne Mccoy, she addressed a lot of the immediate concerns that I'm interfaced with in our community about, trusting the process. And of course, with all the panelists and a lot of the perspectives, it leaves me with information to take back to our community at large, man, and to address some of those concerns that the unfamiliars and some of those skeptics so we can actually give them some better dialogue and understanding, especially those in the senior community, give them some greater insight and some hope on why this COVID and this vaccine is so important. So thank you guys.
And if you just tuning in, this is a special episode of The Breakdown. And right now, you can go to Facebook Live, Power 88 Facebook Live, if you want to watch the show or chime in. You can call 702-647-3688. We are taking phone calls now, 702-647-3688. And the topic is myths and facts about the COVID-19 vaccine. And again, this is in conjunction with UNLV School of Public Health, the NAACP, Latin Chamber of Commerce, Nevada Minority Health and Equity Coalition, United Natives, and KCEP Power 88. And the reason why I felt this was important when Madam Vice President Roxanne Mccoy of NAACP gave me a call about it, or she actually sent me the flyer. And when I saw the flyer, I thought it was important that, you know, this is a good webinar. This is a good panel. And it would be great if we can get as many people to hear this as possible. And that's when the idea came up to share, to partner with, for Power 88 to partner with UNLV and all of the sponsors that are involved, so we can help get the word out and spread across the valley. But also on our Power 88 app, we have a lot of listeners that are out of town, and we have a lot of listeners that are in other countries, because Vegas being a unique destination spot, we find a lot of people come to Vegas, and a high percentage of people, when you first go to a new city or you going on vacation, when you get your rental car, first thing you do is find what radio station are you going to listen to while you're here on vacation. So the great thing is that many people heard about 88.1, and then they learned we had an app that they can download on their phone or devices, and they continue to take us with them once they leave Las Vegas. So we have listeners in Africa, Europe, Australia, you name it, they are there. So I think that with that being said, this makes that much more important to see, for other countries to see, and also other states and cities across the nation to see that we have common questions. And this is a way where people can hear answers and do comparisons to whatever's going on in their city or their community. So I commend UNLV and all of the partners involved for doing this. And since we've been putting it out there, we've been getting a lot of positive feedback and appreciation for it, because there are a lot of misinformation. I guess you can call them fake news, or you could, call it just people just don't know, like some of the panelists mentioned earlier, a neighbor telling another neighbor based on what they think they know, and people going on the internet, and things are purposely being put on the internet to mislead and misinform people. So I'm glad that we're doing this. And I believe this is something that the listeners and the viewers can have trust in with the information. So this is a very credible program right now. And I look forward to doing it again, because I know that there are going to be many questions, and there are going to be people who may have missed the program. And by the way, you can review this again on Power 88 TV and other platforms once the show is over, if you're just tuning in and you missed a lot of this great information and knowledge.
Thank you, Professor Knight. And again, thank you to KCEP for helping us to amplify this out to a wider audience. So just quickly, some technical business we need to do here, folks. There is an event survey that's on the chat. It's also on the Facebook and Zoom. So if you have a chance, please go in and complete the survey for us so that we can collect the information. Data is critical as we move forward with the vaccine messaging and all the other things that we want to do to reach our community. So we're going to be opening it up for other questions. I've got some here that I'm going to start off, and then we're going to be looking at through the radio and other venues where we have questions coming in. So right now, to our two Dr. Madison and Dr. Martinello, if you get the vaccine, can I still get COVID?
Good question.
Do you want to take that one, or do you want me to take it?
Oh, go for it.
So the short answer is yes. But here's the thing that is different. And the thing I really want people to take away is, even if you do end up contracting COVID after you've been vaccinated, because again, the 2 vaccine candidates that are currently authorized by the FDA are 95% efficacious if you get both doses on time and 14 days after, right? Because it takes a little bit of time for your body to develop those antibodies. So if all of those things happen and there's still that 5% chance that you may come in contact with maybe one of those variants that isn't quite covered by the vaccine, the great news is that you are not going to die from severe illness associated with COVID. So that is really the biggest thing that we want people to understand, is that although the vaccine may not be the silver bullet that you want it to be, it is going to drastically impact the amount of death and destruction that this pandemic has been making on all of us, and the fact that we are overburdening our healthcare system. I was thrilled when I saw for the first time we had more people vaccinated than cases in the United States last week. Just thrilled. Granted, I am a big public health nerd, but these are the things that get me up in the morning and fill my cup up. So we are making progress, people. It may not be perfect. It may be a bit messy, but it is progress. And we are getting better every day. Every time I have a vaccine clinic, I learn and I make adjustments, and we get better and more efficient, and we provide better service to our elderly and our vulnerable populations so that they can come back and have confidence that when they are there, they are going to get a vaccine that is safe, effective, and they can go back and tell their community and their tribe, which, by the way, Dr. Crystal Lee, absolutely love that you brought that up, because it is all about your tribe, right? You need to check everybody in your circle, right? Because if they're not doing what you think that they should be doing, you should be asking questions why. So they're going to go back, talk about that experience. If they have a positive, just everything about that experience, they're going to go back and they're going to tell a friend, and then they're going to tell another friend, and then they're going to tell another friend. And honestly, that's all that we need. We just need that one little seed, and then it'll grow and it's going to multiply.
I love the passion.
Jose, did you hear that passion? Did you hear that enthusiasm?
That's what it's going to take for us to overcome this thing and beat this thing. Professor Knight, we're opening it up for questions. On your side, is there anything coming in on the radio that you want to put out there to our panelists?
Not on the radio yet, but I did have a question on the Facebook Live, and it's from Dana Middleton. She says, I know medical doctors who say that the vaccine is gene therapy and doesn't mean you won't get it. At best, it will help not be so severe.
Okay.
So
I'm not a doctor, but even if that was the case, that it's not going to cause, it's going to help not cause so many deaths and so many long hospitalizations. That's a good thing. But I'm sorry, doctor.
No, it's good. So there are certainly people out there who misunderstand this. It is not gene therapy. We can put that out there real quick. It does not go into your DNA. It does not impact your genes. It uses what your genes, so your genes normally, they're transcribed into mRNAs and make proteins. So that's probably where some of this misunderstanding comes from. But what we're doing is just giving the messenger RNA. We're not going anywhere near the cell nucleus where all the important genes are kept. Now, vaccines typically have 4 possible things they can do. They can prevent you from getting infected. They can prevent you from getting sick. They can prevent you from getting critically sick and dying, and they can prevent you from spreading it. And those are the 4 primary things that we look at when we look at vaccines. So this vaccine is 95% effective at not having symptoms and getting infected. And that's for the most common strains. For those people who still do get infected and have symptoms, you're seeing almost a 100% effectiveness against dying or being critically ill. So even if this vaccine does not stop you from getting sick, as my colleague said, it's going to stop you from dying. which is really the single most important thing. If you have to look at what vaccines can do, preventing death is always right at the top of what you want. And then below that, you want to prevent from getting symptoms. And then below that, you want to prevent from getting infected. And preventing spread is a whole additional difficult thing, but we can do that with aggressive mask wearing, hand washing, and social distancing. So it's not gene therapy. And granted, it's not 100% effective at preventing you from getting the coronavirus. 95, I mean, that's pretty close. And we're in Vegas. We love odds like that. I mean, I would bet on odds like 95%, but it is 100% effective in the studies of preventing death. And that's really something the community can take from that, is that if you have loved ones that you're worried about dying, you want to get them vaccinated.
Hey, I would say, I just want to put it out there for the listening audience. 702-647-3688 is the number, 702-647-FM88. Right now, I have a question about, we know there are 2 vaccines out there now, but there's talk of a third one by Johnson & Johnson. Can someone give us a little bit more information on what that would look like, the percentage of it? And from what I understand, it's you only need 1 shot. Now, I think people will be very happy about that part, but can you expound a little bit on that? One of the doctors or both doctors, ladies first.
I see Dr. Madison getting really excited, and I love hearing her speak, so I'm going to defer that.
Well, first of all,
Great
thank
question.
you. I appreciate that. You guys can see my passion for this. And I really do love talking about the facts, because I think the more we can get accurate information out to the public, the more informed people can be, and they can make positive decisions for themselves and their families. So the person who asked the question is absolutely correct. So as of right now, we have 2 vaccines that have received what we call emergency use authorization. So they still haven't gotten that full FDA approval, but they have received authorization to be used in the United States. And then we just got word last week that Johnson & Johnson, which is of all of our vaccine candidates, the only one that was tested as a single dose injection, versus all the other candidates out there are all 2-dose variations. So the Johnson & Johnson vaccine does have a committee meeting scheduled at the end of this month to see if it will get that EUA status from the United States. We've also been hearing some chatter around the Oxford University AstraZeneca product, which is already approved in the UK and the European Union, that they will also be seeking EUA status in the United States, either end of February, beginning of March. Part of the reason why we've been seeing a little bit of a delay there is because of some recent data that has come out about the decrease in efficacy associated with that vaccination, in particular for the South African variant. So they have decided to take a pause on offering that vaccine to their healthcare workers. But again, it's a pause to identify the science and the data to see, is there something that they could, do to enhance that vaccination, because it is slightly different than these messenger RNA products that we talked about. It is very similar to the Johnson & Johnson product. It's what we call a modified adenovirus. So it's a non-infectious host that has the genetic material in it that can produce an immune response to the COVID virus. So with all of that being said, as of right now, we've got 2, possibly 3 by the end of the month, and maybe 4.
Jose?
I was going to ask, what is the percentage? I know earlier you were saying 95% for the other ones. What's the percentage on these new ones coming out? Do you know?
Yes, so great question. Did you want to take that one?
No, so I don't have the updated data on it, so I'm going to defer that to the expert.
Okay, so Johnson & Johnson. So one thing I do want to say is that I know there has been some debate out there about the efficacy being less, but I will tell you that as somebody who's been in public health for a while, if we had seen the Johnson & Johnson data before we saw the Moderna and the Pfizer data, we would have been ecstatic, because it's so much better than the flu vaccine, right? So this 72%-ish efficaciousness for mild to moderate disease, and then 85% at preventing severe illness and death is like amazing, right? But unfortunately, because we saw it after the Moderna and the Pfizer data, it looked a little bad. But here's the thing, if you look at it in comparison to both the first doses of Pfizer and Moderna, they are comparable. So that's how I will address that.
Nice.
Jose, may I say something?
Yes, sir. Quickly.
I want to mention that one of the things that we kind of didn't talk about here was the importance of testing. And there's, when all this started happening, this group got together, Está en tus manos, it's in your hands. It was Erica Vills and Jennifer Lopez, and it grew and grew and grew where, behind the hard work of Marilyn Kirkpatrick, testing sites started popping up everywhere. And that's when we started really getting a turn going on here by the amount of testing, knowing how many people were infected. And I just think that has led us to better moments and better part of this journey looking forward.
Well, and that's a great segue. We have a question from the audience, and I know some of our panelists have to get off the call here soon. So I'm going to pose this one to Dr. Crystal Lee first, and then our other community panelists. But in regards to the message, and Peter, thank you. The testing is still a critical component. Folks, while this pandemic is still going, folks still need to go out there and get tested, and so that we can track this thing and participate with the contact tracing and all those other things that are still happening to ensure that we're keeping our community, getting our community safe and healthy. But in response to a question from our community members, what messages will resonate with the BIPOC, Black, Indigenous, people of color families about the COVID vaccine? What do you think, in your experiences, what needs to be included, or what's going to be out there that is going to make this message and get out to folks? Dr. Lee, can you kick us off before you have to sign off?
Well, I can't really speak for all communities. I can speak for Indigenous communities and kind of elaborate on what has been working thus far in messaging. First, getting the elders involved in the messaging, especially utilizing our tribal languages. And our elders are the wise ones, and they direct us. No matter how educated I am, I will never be wiser than an elder. And so they are the foundation of our messaging in multiple capacities, which includes our language and our culture. So that is probably the single most effective thing thus far that has helped our community feel more comfortable in getting our messages across for the vaccination. Thank you.
Thank you, Dr. Lee. Thank you for joining us tonight. I know she has to sign off, so keep fighting the good fight. And we know you got your hands full out there, and thank you for what you're doing. And thank you for making time to join this panel tonight. Roxanne, I'll throw it over to you next.
I think that what will make our community get more people in our community become vaccinated is access to the vaccine. I think by us continuing to get the facts out there is helping a lot to ease the anxiousness that's going on within the community and a lot of the misinformation. But more importantly than that is access. I hear there are a lot of people in our community that want to take the vaccine, but cannot get through the phone lines, that don't have access to get appointments in order to do so. And so we've been talking and having a lot of conversations, and we furthered it with you, Jose, in collaborating on figuring out how we can do some pop-ups within the minority communities, just so that those that don't have access to the internet or are not getting the information like a lot of us receive it, can have access to be able to know that they can go somewhere, feel comfortable, and take the vaccination. But being informed, educated on it, and having access will play a huge role in getting more minorities. And it's not going to hurt that they see more of their community leaders stepping up and taking the vaccine and talking about their experience with the vaccine. So we are going to need a lot more of us stepping up and taking the vaccine and coming back to our community and sharing what that experience has been like. So thank you.
Thank you, Roxanne. Aaliyah?
really want to put an emphasis on meeting our communities where they are with the information that they have. And so it's really been super important to have these dialogues like with the community and understanding what misinformation they have received, what information they currently have, where just really meeting them where they are. And then we have been making a really big effort to meet with a lot of those community leaders who serve a variety of diverse populations, and understanding what are the best ways to not only disseminate information to these communities, but um, what are the best means of communication. So whether that is having those, whether it's fact sheets, or it's you would rather watch a video, or you would rather hear and visually see something, or you would rather have something in a quick like 4 like sentences for you to like quickly understand. Like our communities all learn in a variety of different ways, and have a variety of different means to receive information. And so I really want to put the emphasis on really meeting all of our communities exactly where they are and the information that they have and the variety of ways they learn, and disseminating information in that way. So it really does resonate with them. So it's not a broad strategy, like there's one message out there that is said in one set way, but it is one message almost said in a variety of different ways, depending on how information is absorbed or understood. And then also really putting an emphasis on that language piece, because we are Nevada, we are a very diverse like community and population, and so really making sure that that information is available by that means as well.
Peter?
Sorry, I was on mute. You know, I just think about this whole process that we've been going through, and I'm gonna probably go off script a little bit here, but you know, in my work as president of the chamber, I'm just telling you, there's so much pain out there. You know, when a person puts their entire life savings into a business, and something comes into our community that we don't understand, and shuts us down, and their dreams are shattered. You know, I think that's kind of what I have to mention, and why it's so important that, man, when you're fortunate enough to be able to get vaccinated, get it, please. It's the only way we're going to get to a situation where we can open our community back up, this incredible community that we have. The only way we're going to do that is by you know, putting ourselves out there a little bit and trusting the medical data and science. And it's the only way. We really have no choice. It is that dramatic. And so, you know, I encourage folks, get tested. There's test sites everywhere now. It's just amazing to me. The ability to get tested, the ability to get good information, solid information, not your neighbor's information, but real information. It's available. It's available between all of us. Call my chamber. Call Roxanne. I mean, you know, call the doctors. Everybody's available. Everybody's in this thing together, trying to get our community healthy and open again. So that's my words today that really weigh heavy on me.
Thank you, Peter. Dr. Martinello, I'm going to pass this one on to you. Another question from our audience. Why is it important for those with underlying health issues to get the vaccine?
Sure. So what we know about this particular infection is that it does tend to hit people much harder, especially if they have underlying conditions. Some of the biggest difficulties we've seen are patients who have underlying heart disease, patients that have underlying lung disease, neurologic conditions, blood clotting disorders. The coronavirus is a particularly nasty little bug. It causes a lot of secondary issues in patients. So we used to think of it predominantly as a respiratory virus, and that's how we saw it at the start, where it impacted the lungs. Patients had difficulty oxygenating. But much more recently, we've also been looking at a lot of these secondary pathologies. The blood clotting that it causes has generated pulmonary emboli, which is a blood clot in the lung. It's caused heart attacks and strokes. So anybody who has a predisposition to another medical condition is automatically going to be at much higher risk from this disease because it's going to compound the existing medical problems as well. And that's not to say that people who are healthy and have no medical issues aren't impacted by this, but we've seen a very disproportionate amount of morbidity and mortality in patients with underlying medical issues, which is why they were in that initial phase of people during the vaccine rollout was get the patients who could potentially be the most harmed by this vaccinated and kind of work our way towards healthier people. But nobody is spared in this. It's just, if you have underlying conditions, you need to be especially cautious and seek out medical attention much earlier in your course if you were to develop this.
Thank you, Dr. Martello. And I think let me pass this one on to Dr. Madison. Some people have said that they don't want to take the COVID vaccine because there is not a lot of long-term data on the safety of the vaccine. Can we be confident that the vaccine itself won't have some type of long-term side effect?
So I think I put this in the chat feature earlier, but just to address this concern again, here's the thing. Messenger RNA technology has actually been around for a while. We actually have pretty good data to support its use in cancer research. It's just this is the first time that we've employed it for vaccine technology. So I would kind of look at it from the standpoint is that it's novel, but it's novel for vaccines. It's not a completely novel technology as far as using messenger RNA for the purposes of treating human conditions. So the first thing I would say is, of course, we don't have a lot of data. Obviously, the beginning of these clinical trials started in April of last year. So we're coming up on about a year that those phase 1 and phase 2 trials were started. But the thing that I would emphasize is the fact that we are doing this real-time surveillance. And this is something that is unique to this vaccine. And it's something that we implemented because there has been so much scrutiny on this particular vaccine and because it is a global pandemic. So the VSafe program is something that the CDC created. And so everyone who is vaccinated, we ask them to sign up for this SAFE program, and it is a post-implementation surveillance program that is done in real time in order to determine what side effects people are experiencing, as well as whether or not they have gotten their second dose on time. So as far as long-term side effects, I really think about this vaccine, in particular, the two candidates that we have right now, which are messenger RNA. I think about it as kind of the Snapchat of vaccine, right? So it goes to your cell, it presents that spike protein, and then that messenger RNA degrades within minutes to hours. So it really just shows the immune system a picture. It doesn't stay around. So really, when you think about it in that regard, there's not a lot of long-term side effects that you could get from something that doesn't remain within your cell or in your body. So again, the response that you're getting is because we are empowering our immune system to respond, and not because of the components of the messenger RNA itself. So I hope that helps.
No, it does. And I have just one last quick question, because we're getting ready to turn this over to KCEP, and they're gonna continue with the last part of this forum tonight. But just quickly, do I need the vaccine if I've already been infected?
So Dr. Martinello, do you want to take this one?
Sure. So I can start from my personal experience. I was infected with coronavirus back in August of last year. You do still want to get vaccinated. The reality is that we don't know how long your immune system is going to continue to recognize this virus through what they call natural immunity. So if you were infected with the coronavirus, once you are no longer having symptoms, you should highly consider getting vaccinated as soon as possible. One very important thing that we've noted is that some of these novel viruses that are coming out, some of these mutant variants, they are reinfecting people. So you want every opportunity to defend yourself against these other strains, because the second infections typically have been a lot worse for people. So even if you've had the coronavirus, absolutely go out, seek out vaccination. And if nothing else, it will give you a much longer duration of protection from it.
Thank you. So for this part of it,
back on that really quick.
Yeah, go ahead, Dr. Madison.
The other thing too is because of these new variants, we do know that having wild type infection is most likely just one strain. And so you will have further protection from vaccination against these new variants that we see. So you actually have better protection from vaccination than you do from getting the wild type infection. That at right now, we think only lasts about 90 days. We think that there may be some T cell activation that may be a little bit longer than that, but not really much more than the 90 days. And so getting vaccinated is really going to help you to be protected against these new mutations, as well as give you more long-term immunity, which we think is possibly going to last anywhere from maybe 2 to 3 years. But again, we won't know that until a little bit later on, because technically we really haven't hit the peak yet of this pandemic.
Right. So, all right. Well, folks, I want to thank everybody for this part of the forum. Roxanne, Peter, Dr. Madison, Dr. Martinello, Aaliyah, Dr. Lee, who had to check out earlier. But I want to thank everybody, KCP, for joining us and being a part of this tonight, this conversation. I know it's gonna continue on air with KCEP. Professor Knight will be taking over. I know our panelists, I think they've all agreed to stay on and participate in that next section of it. So on behalf of the coalition, the Nevada Minority Health and Equity Coalition, the UNLV School of Public Health, and all of our partners who joined us tonight, I want to thank everybody. Folks, please, 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 if you heard anything, I know there was a lot of great conversation. The vaccine is critical. If we're going to beat this thing, we all need to do our part. Whether it's continue to get tested, continue to spread the word, the messaging out there. There's going to be a lot of initiatives and efforts coming forward. I'm hopeful to it, especially now with the new Biden and Harris administration, that we're going to be able to continue to do some really good things and have a positive impact as we all continue as a community to get through this pandemic and beat this pandemic. So again, on behalf of the coalition, UNLV School of Public Health, thank you, everybody. And Professor Knight, we're going to turn it over to you and your team and move it forward. Thank you, everybody. Good night.
All right. And thank you, Jose. Excellent job moderating too, by the way. You was pretty smooth there. All right. So thank you. And welcome back. This is once again a special episode of The Breakdown. Yours truly, Professor Knight, Lady AK, and Lou Collins, and also our illustrious panel is still with us. 702-647-3688 is the number, 702-647-3688. Or if you're on a webinar, you can still ask your questions and we'll try to pick it up that way. But I saw Lady AK can chime in right now. So she had a few questions on the chat that looked pretty interesting, that maybe we should answer some of these questions on the chat that the listening audience would probably appreciate and benefit.
Okay. So my question was regarding an article. Y'all forgive me, you know what I'm dealing with in the background there. So I was reading an article from Fox 5 that was speaking in regards to the virus being found in wastewater. And my concern, my question was, Dr. Christina Madison responded with, wastewater is an indirect way of finding out the incidence of disease in the community because the virus is shed in fecal matter. This has also been used as an early warning system in some communities to see when case rates are about to go up. You can shed virus prior to having symptoms, as well as those who are asymptomatic carriers. My next question was, should people stay away from public restrooms as a result of this, and how does it impact drinking water? She said you can't get it from drinking water. This is Dr. Christina Madison. You can't get it from the drinking water. The virus is dead. It's transmitted by respiratory droplets and community spread by human-to-human contact. Now, what I did find interesting was I was sent that article during this transmission here. And as Dr. Madison responded to me, I sent that information back to the person who sent me the article, who I don't think is listening to the program right now. And I found it interesting that this doctor, who's been sitting here speaking this entire time, coming from nothing but a heartfelt place, and obviously a place of massive intelligence. She's obviously a quite intelligent woman. And his response was, let's hope so. And I was like, well, she's a doctor and I'm not, and neither are you. So are we gonna go with Dr. Madison, or we just gonna ad lib? Because I don't want to ad lib. I think I want to go with what Dr. Madison said.
And you're doing the right thing.
Yeah.
Thanks.
Yeah, I think that's one of the things that we're all finding in our different communities, our diverse communities, and I would say everywhere, not just in Vegas, is that, again, that information and skepticism and, what they heard someone else say, we have to start trusting the science and the doctors. I mean, that's all we have. Yes.
One of the panelists mentioned earlier, what social media has made this virus look like for us, because you keep in mind it went from a little shaky, then it went to somewhat serious, then the Black community, we always go for the humor element of it, and then it went to if you drank MG 4040, Mad Dog 4040, you can't get it, and if you drink Four Locos, you can't get it. We did that whole thing, and then we started to see it impact people that we knew, and we kind of eliminated the humor factor from it. But I think that what has driven it on social media now is, of course, the extra woke community, and they were the ones that were heavy on the RNA. They're changing your RNA, and this is what it looks like, and it's like, well, how do you even know that? But then it also then went to the different people who received the vaccination, with the great side effects, the major side effects. Those people were the ones who are going viral. So you have people who have received the vaccine and are doing fine. They don't have any issues, but they haven't said anything. But you have people who have had these massive side effects, and their videos go viral. You also have people who have had coronavirus, and for some reason, we're treating it like an STD. Like, people get it and then they don't want to say anything. They just stop posting on Facebook. And it's like, well, we know you got it. Tell people what your experience is so they can understand, because there are some people who still think that this is a hoax. There are still some people who don't think that they can get it. I mean, you see them all the time with their masks down. Like, you can tell they only have it on their ears because the sign on the store says so, but it's hanging halfway out their chin, and people still aren't taking it serious. Atlanta has a whole different idea of what they're gonna do about it. They just down there, they don't care. So I just there's so much that I think has to be done more in our communities, because it's not just the Tuskegee experiment. Most people can't even tell you what actually happened during the Tuskegee experiment. They can't tell you about Henrietta Lacks and everything that she endured and went through for the sake of science, without her permission, a Black woman. So there's going to be doubts. But it's always going to be so interesting that the community, that we won't change our eating habits. We kind of put health on the back burner when it comes to a lot of things. We don't like going to the doctor for just to get checked up on. We wait until something goes wrong. We don't really plan with our life insurance and things like that. And all of these things are a reflection. The queen that was speaking from the indigenous community, she was speaking some deep facts, talking about what it looks like for us to lose our elders, lose our elders. You all think of where we are from the elders we were losing just off of, I don't want to say regular, but not from the pandemic. And now look at what it's done to our community and what it will continue to do when we lose our storytellers, when we lose our path pavers. That's going to be detrimental to our community. We're looking at it on both ends, with our future generation not being educated properly in most homes, and then we're losing our elders. So where does that put us 10, 15 years from now?
Right.
I just saw an interesting question in the chat over here. Does the vaccine insert a chip into your body? You see, this really does exist.
Oh yeah.
Right. We've been hearing that and connecting it to the G5 towers that's being put up, and the G5 towers are going to put this layer over the community so they can track you through the vaccine. And it's a lot of crazy stuff out there. But I want to tell you this,
Right.
to those who think it's still a hoax, I'm gonna tell you, when we first found out about it around February, March of 2020, you know, I had an auntie out here that was visiting Vegas with my mom, and they was out here for the month of January. Then they went back to New York. I'm from New York, and they still live in New York. And she around March, the end of March, that's when it became an epic center in New York. And actually Queens was the epic center within the epic center, but no one really knew quite what this was yet. And my aunt who was visiting out here, her pastor asked his congregant to support another church at a homegoing service in Queens. She went to that, and it didn't take any time to where she got sick. People at that church started dying. She ended up in the hospital. God bless you, Dr. Madison. I saw that. And then she ended up, long story short, she ended up dying from coronavirus at 71 years old in the hospital. No one can come to her. No one can visit her. Thank God that the healthcare workers, shout out to them, they was mindful enough to take her iPhone and FaceTime her daughters. And they were able to say, I mean, it was just the saddest thing because no one could visit. They had to say goodbye on FaceTime. I mean, that devastated me. And from that point on, since April 1st, 2020, I knew this was real. And since then, I've had other family members that's passed. I've had other family members and friends that's tested positive and either had the coronavirus. And the latest in my story, and no one knows, but I like what Lady AK said, we have to tell these stories so people know that this is real. My youngest daughter, Lyric, she contracted coronavirus last Monday, and she's a model, but she also worked for the Boys and Girls Club out here. So they called her back, and she was at the Boys and Girls Club. And on Monday, she was around kids, and she said some of them had runny noses and stuff, and she was trying to do the right thing. Well, later that night, she started having symptoms. And then by Tuesday, she went to go get tested, and the test came back positive. So she went through a lot of the symptoms, and she had a lot of bad nights. It was ups and downs. Right now, as of today, she's starting to turn the corner, but she still doesn't have a taste of her taste or her smell, and she still gets fatigue a lot. And our concern is that because she's a model also, she's 5'11" and about 115 pounds or something like that. So we're really concerned because she's actually, petite. But I thank God that she's starting to turn the corner, but people need to know that this thing is real. And with that being said, my question to the doctors is like, if she was able to catch it that fast at the Boys and Girls Club, what is it going to be like when they open up the schools? When they start opening up schools, is it going to be an outbreak, and then we're going to have to shut it down again because of the, all of the myths that, kids can't catch it, you can't get it from them. But we have proof now that you can get it from children. And for those children that don't have it in the school or the Boys and Girls Club, and give it to the next child, then that child actually takes it home with them. How do you see that outcome? Is there already a plan in place that you know of, since they're talking about opening schools? And I'll leave it at that for someone to answer.
Sure. So, I mean, in terms of reopening schools, every school district and every county and every state are working on this problem right now. And the reality is that we have to go back to the real basics of this. It's the hand washing, the distancing, the limiting the number of people within rooms, and all those what they call non-pharmaceutical interventions. And that's how we can mitigate the spread. And there have been some school systems that have opened back up, and they have not resulted in large numbers of people contracting the disease. And we're very fortunate that the children in general do better if they do get infected with it. They tend to get milder symptoms, but it's not to say that this is a benign thing. So the school systems are all working on their individual plans to safely get children back to school, which we want children back to school. I think many people have probably seen the articles about the increase in suicide rates in children and teenagers. I mean, this is a very real problem. So we have to balance the non-pharmaceutical interventions in a classroom where we have limited number of kids that aren't moving around, that fortunately can still get that education, versus what happens if we continue to keep them home. And really the big push should be, how do we get those vaccines into arms so that we can mitigate that even further? So our kids do at some point need to go back to school. There's no doubt around that. That's also a part of reopening the economy so that parents can go back to work. The school systems are developing plans. I can't speak for all the school systems, only because they're all very unique. But by and large, it's social distancing, hand washing, mask wearing. Some of these schools will work on increasing the air exchange within rooms and such, and then mitigating their exposure with other classrooms. But is it going to be perfect? Probably not. Can we do it safely with the right plan in place and with an acceptable number of people getting vaccinated? Absolutely, it can be done.
I would also just want to echo the same sentiment that part of the plans that are being looked at also are looking at additional testing and then vaccinating those those educators. So it's really a multi-faceted approach, but ultimately the bottom line is that if you have widespread community transmission in your area, doesn't matter what you do in that school, because it's gonna come in, right? And so that's also part of this as well. And so we are trying to not only distribute this vaccine quickly, but we're also trying to get this vaccine out equitably. And so looking at places where we can get the biggest bang for our buck, I think educators are the biggest bang for our buck, right? Because we want people to be able to get back to work, especially because we see so many women who have exited the workforce because they have been forced to be at home because of online learning constraints, because of children not being able to go to school. So I think that that would be hugely important, as well as the use of something called pooled testing. So this is something that's going on in certain counties that they've been extremely successful with, where they have had individuals in basically their own pods. So they test a classroom and they pool the testing in order to maximize their resources. And then if somebody in that pooled testing tests positive, everyone in that group gets pulled out. And then it's an early warning system before you get this massive spread of infection throughout the school. So those kinds of modalities, in addition to decreasing the community spread in the location where you live, as well as vaccinating your educators, all of those things combined is going to help us to reopen schools safely, get people back to work, and moms back in the workforce.
Excellent.
Beautiful.
Lou, did you have any questions or comments that you wanted to chime in on?
Well, actually, Craig, I'm just being an extreme observer here, man, and I'm just so proud, man, that this initiative came forward with the collaboration of all the professionals that are here tonight, man. And of course, we code ourselves as the information station, man, and I'm sure, the information that's being disseminated this evening, man, is monumental. Because again, as I was sitting here and I was channeling some thoughts, and I was saying to myself, we know that some people find comfort in ignorance, find comfort in ignorance, and so when the information is before them, they choose not to apply it, and so or choose not to be adaptive, in that way. And so again, I'm just so thrilled, man, because again, we brought all the players to the table. Of course, as I stated, we get inundated with questions, and people really trust us. Because again, it's about the messenger, it's about the messenger. The message does not get disseminated in most cases if people don't trust the messenger. And so again, a lot of good information goes unnoted because people hear it, but they don't trust who it came from. Hence, we talked about, the Tuskegee experiment, et cetera, et cetera, et cetera. So I'm just so grateful, man, that all the collectives have come together, man, to see how we can actually minimize the ignorance of people not deciding to go ahead and get tested and go ahead and take the vaccination, man. So that's the only comment I have. I just want to thank everybody, man, from the top of my heart. Thank you guys for finding the time to come together, man, so we can talk about what's really impacting. Because just like we need to treat it the same way as a sporting event. Everybody came together for the Super Bowl, and everybody comes together for the championship, and so we need to treat it in the same spirit. Have the same type of impact as we would treat a sporting event.
Okay.
That's Lou Collins right there.
Yeah. Drop the mic.
What's up, Pete?
How you doing, buddy?
That's that's Dr. Peter Guzman now, because he was laying down some knowledge too.
Yes, sir.
For the president of the Latin Chamber is a doctor. We're gonna start calling you Dr. Guzman.
Okay.
Paying
me like
okay, we got to work on that part. We just have a few minutes left, but I do have a question on Facebook Live from Martin Larson, and he says, "How long will my antibodies from having had it protect me? What is the latest? The first I heard was 6 months. Now I heard it was 2 years or possibly a lifetime." Any doctor want to take that? Dr. Madison?
Well, I think we're both going at the mute button.
Oh, okay, go ahead. Yeah.
So as far as natural immunity, Dr. Madison kind of touched on this earlier. We know it's probably around 90 days is a pretty good estimate. And that's why they told people if you get coronavirus, you could wait up to 90 days to get a vaccine, but that waiting period is not mandatory. For the vaccine, we don't know yet because those study participants are still, I think, right under a year out right now. And they're still demonstrating excellent immunity by and large. So we don't know how long this is going to last. We could have hit the jackpot and we're looking at lifetime immunity. Optimistically, we're at least a year, probably a couple of years. We'll have more data as the study continues on over the next months to years with those original study participants and also the surveying of the community and how well they do. So we don't know how long it's going to last yet, but we're optimistic that we're so far looking at least a year, which is an excellent time frame. If we can get everybody vaccinated in that 1 year time, then we're really looking at remissing this thing down to a level that's almost undetectable. If it's a lifetime, then we've hit the jackpot. And then every vaccine, of course, will be a little bit different. So, saying how long this immunity will last, we really have to look at individual vaccines. So how long will Pfizer last? How long will Moderna last? How long will J&J last? So far, so good, just a little bit under a year out. I mean, we'll talk again this time next year and see how those folks are doing as far as their antibodies still firing along.
Excellent. Dr. Madison?
Yeah, I would definitely agree with that. Most of the individuals that I've discussed this with in the public health space has said that it's not quite annual flu, but it's not quite the every 10-year tetanus. So it's probably somewhere right in between. So maybe 3 to 5 years, depending on if these nasty variants kind of put a wrench in things. But that's what I've been hearing. So I would definitely echo the same sentiment.
Excellent. So we're out of time, but what we can do now is do last words. So everyone gets about 15 to 30 seconds of their last words. And let's start with Aaliyah Goody from Immunize Nevada.
Really just happy to have had this conversation and dialogue with all of you. Just encourage everyone to seek information and to reject those myths and misinformations that you might be hearing. Immunize Nevada is a huge resource and a pool of information for all of you to have. So really encourage everyone to utilize our website and our resources and to ask questions where you may have them, but really happy to have been here tonight.
Thank you, Aaliyah.
Thank you.
Next, we have Madam President Roxanne Mccoy from the NAACP. Last words.
Yeah, thank you all for being a part of this great panel that we had tonight. It was great discussion, great information, a lot of facts disseminated, and we hope to continue having this conversation and sharing the stories about our experience with the vaccine, as well as our experience with our family members with COVID. So thank you.
Excellent. Okay, next, last words. Dr. Madison?
Oh, sorry, I didn't hear.
Oh,
name
yeah.
was sorry, cut off
That's
there
okay.
for a second. So I am a big supporter of the public health measures. So wear a mask and wash your hands, social distance until we can get to that herd immunity. And when it is your time to get vaccinated, do not hesitate. Get your sleeve rolled up and get that injection.
All right, excellent. Okay, next, Dr. Peter Guzman with the Latin Chamber of Commerce. Last word, sir.
I appreciate that, Professor Knight. That's going to catch on now.
Yeah.
Honestly, I want to say thank you to Roxanne, my friend Roxanne, and I want everybody to get vaccinated. I want everybody to do the right things. But what I really want to close out with, if you don't mind, is I hope and pray that this isn't the last thing that we do together. You know, our communities have the same struggles.
Absolutely.
In a lot of ways, the same fight. And us coming together has really made my heart feel a lot better today, Professor Knight. And so all I can say is that if you ask me to be somewhere, I'll be there. I make that promise to you. And I'm going to do more of it on my end, too. I hope we can come together for the good of our community, because our community, you know, no offense to anybody else's community, because I care about all people, but our communities seem to always get the short end of the stick on all of this stuff, man. And it's up to us to try to help change that. So count me in whenever you need me, Professor Knight.
Absolutely. And likewise, Dr. Guzman, you call us anytime the Latin Chamber of Commerce or your communities want to come together, because that's the example of we have to start showing to the public the unity. We talk about it, but we have to be about it and set that example. That's why our moniker and you can see behind my back in our studio is "We Are One." And we mean that too. Thank you again. Now, Dr. Martinello, last words.
Yeah, I just want to say thank you to everybody for having me out with this wonderful group of intellectuals who are all legitimately trying to save their communities and the world through getting excellent, honest, scientific information out to as many people in all of their communities as possible. And to be able to take part in this is truly a blessing. And I look forward to the day that I can sit down in person with all of you and have a meal and talk about those old days where coronavirus was around, and look back and celebrate the fact that we all came through this together.
Excellent. And thank you to the panel. And I look forward to doing this again. I think we will do this again because this worked out so well and it went so smooth. And just so you know, when we don't get phone calls, that's a great sign. That means people are listening and we're answering their questions so they don't have to call. So we've had this before on the show where we had no calls, and that was the feedback that we received. Is like, well, all the questions were answered and it was interesting information, and I just wanted to keep listening. So that's a great thing. Lady AK, then Sweet Lou, then we're gonna get out of here.
We got that Grammy music playing for us. Okay.
To wrap it up.
I want to make sure that we invite everyone out again to the Ask a Lawyer event, y'all. This is tomorrow from 5 to 7 p.m. Telephone consultations only. Register in advance at lacfn.org/ask. Everything from immigration, family law, child support, evictions. They're going to help you out with all of that. And I want to give a huge shout out to a faithful listener, y'all. William Boykin, that's Miss Michelle Boykin's husband. Y'all, he listens to us every single Wednesday. So if you've been using those wet wipes and flushing them, contact him over at boykindrain.com because he got a plumbing service.
All right, Sweet Lou, real quick.
All right, man. Hey, I'm just so grateful again, Craig. I just want to thank all of our panelists, man. Thank you guys here for sharing a wealth of information and giving us insight. And collectively, we can make a difference, man. And again, I want to see this reoccur as long as we need to, man, so we can keep the community informed on making informed decisions about protecting themselves, our community, and families. Thank you, guys.
All right, and we want to thank UNLV again, NAACP, Latin Chamber of Commerce, Nevada Minority Health and Equity Coalition, United Natives, and Power 88 KCP. Our listeners, thank you so much. It's KCP 88.1 FM, Las Vegas, owned and operated by the Economic Opportunity Board of Clark County, broadcasting in HD1, soon to be HD2 and 3. We are 88.1, where we are one, the people station. And now we're going to take a break. And on the other side is Rufus Harrison with the groove. Good night, everybody.
That's right. Y'all hit your beat. Y'all
Support for KCEP is powered by Annie's Kitchen. Open Tuesday through Saturday, specializing in home cooking. Yams, greens, mac and cheese, barbecue ribs, chicken.